So we get moles, you know, small moles, bigger ones. How do we know if they're irregular and should be checked out?
Okay, so when we're thinking of moles, where the major concern there is melanoma, right? And melanoma is a type of skin cancer which is usually a dark spot that people get on the skin, and that dark spot has the potential to spread internally and kill. So it's the most serious of all the skin cancers that we get. Well, I wouldn't say it's not the most serious of all the skin cancers because there are other, but of the more common skin cancers that we get, the more serious one of those is melanoma. Now, in terms of melanoma, there are two ways that you can get melanomas. One is that you can get it what's called de novo, which means that it appears spontaneously because of sun exposure and damage or some other factor that stimulates it, or it can appear in a pre-existing mole that changes. So it's important to be able to determine whether moles are changing or not. And so we use a criteria called the ABCDs, and that is A stands for asymmetry, B stands for border, C stands for color, and D for diameter, and really it's A, B, C, D, E, and E is for evolution. So in other words, you could have a black spot that appears, and many people will call that a mole, but that may actually be a melanoma that appears all of a sudden. So if you have something that appears and it's not been there before, it's something that should be evaluated to make sure that it's not something like a melanoma. On the other hand, if it's appeared and it's been there for a while, and you have other spots on your skin, then the question is that a mole or is it something else like what we call a lentigo, which is just like a freckle on the skin? And so what we do is we use these criteria. So we say, is it asymmetrical? In other words, if you take the lesion and you draw an imaginary line down the middle, does it look equal on both sides? That's asymmetry. If it's unequal, that's not a good sign. The next part is what we call B for border, and that is if we look at the edges, are they nice and sharp or are they kind of fuzzy? If they're sharp, that's a good sign. If they're fuzzy, that's a bad sign. Then we look at C, which is the color. Is the color nice and even? That's a good sign, but it also depends on the color, right? If it's all of a sudden a very dark color that has changed recently, that could be significant. But usually if the color is even, that's a good sign. If the color is irregular, where one side is different than the other, or there's different types of colors, then sometimes that's a sign that we need to be concerned about. And then D is the diameter, and that is if it's bigger than about the size of a pencil head eraser, then under those circumstances, which is about 6 millimeters, then that's when we can tell more about the moles and we're a little bit more concerned about them. But of all those things, the fact is that, you know, every mole may have at least one of those things that's present, and that doesn't mean that it's a bad thing. These are just ways of being able to decide what is something that we need to look at closer. So just because a mole has one of those factors in it, or a dark spot has one of those factors in it, that's not enough to say it's bad, but it's something that we need to look at it more. One of the key things, though, is what we call E, or evolving or evolution. If any kind of a dark spot or mole is changing in terms of symptoms, it has new symptoms it didn't have before, it's bleeding, it's growing, it's appearing out of nowhere, those are signs that we're really very concerned about. And that's one aspect that by itself is significant enough that you should be seen.